kiss went a little like this, and twist, and twist.
Well, my first kiss went a little like this, and twist, and twist.
I'm waiting on the doctor to come in and see Jessica. She is sick. I had to get the baby today. Got a basketball game. Come in.
Good morning. How are you?
Good morning. We're okay. How are you?
Fine.
I have to. Jessica, you need to get off your phone.
I'll get off my phone when you get off yours.
I have to go. I'll call you back.
My name is Dee. I'm going to be your nurse today. Can you please tell me your name?
Jessica Williams,
Your date of birth?
6/20/2003.
What seems to be the problem?
I don't know, I just don't feel good, got a sore throat, can't make it all the way through practice without getting exhausted.
We need to get her fixed today. She has a ball game this evening.
Have you had any abdominal pain?
Yes,
You play any sports?
basketball.
Has anyone on your team been sick or out?
I don't know.
I'm going to get your vitals, okay? You have a slight fever, 100.6. The blood pressure is fine. It's 124 annually. I'm going to palpate your lip box, okay? Tell me if you feel any pain or tenderness. I'm just going to look at your throat. Say ah for me. Red. Are you having difficulty swallowing? I'm just going to take a listen to your lungs. Just lay down for me, please. Have you experienced any red patches anywhere on your body?
Not that I know.
The skin on your abdomen looks clear. I'm going to take a listen to your bowel sounds, okay? I'm just going to palpate lightly. Tell me if you feel any pain or tenderness. Does that hurt?
Yeah.
Go ahead and sit up for me. Has lab come in and did your blood work?
Yes.
Alright, they did an extra more titer. I'm going to check and see if the results are ready.
What exactly is that for?
It's to check for mono.
Mono? Isn't that contagious?
Yes, ma'am.
I have to worry about the baby now?
Let's just wait to see what the results say, okay? I'll be right back.
Get mono.
I don't know.
Who have you been
I
kissing?
haven't been kissing anybody.
Well, obviously you have.
Mother, I have not been kissing anybody.
Then how did you get mono?
I don't know. Why don't you ask the doctor that? Man,
Hello, I'm Dr. Smith. How are y'all doing today?
We're good. How are you?
I hear you've had a hard time lately.
yeah, when you have an overbearing mother, that happens.
Well, honey, I've got some pretty depressing news for you. We got your Epstein-Barr titer back, and you do have infectious mononucleosis.
Infectious? Does that mean the baby's going to get it?
No, contrary to popular belief, it is not contagious if you do not share utensils or do any kissing. Them girls are practicing with their kissing with their lip gloss and all that, you know. check your spleen out right now. I have a notation in here from Nurse D that it appeared to be enlarged to her, and I'm going to check your throat. When I finish with this, we're going to talk about your playing sports. I just need you to breathe normally, and I'm just going to palpate in here and check your spleen. Your liver. Go ahead and sit up, honey. Check your throat. Stick out your tongue out. Very good. And your throat's been pretty bad. You've been in some kind of pain, haven't you?
Yes.
I've written a prescription here for you, Mom, for Tylenol with codeine.
Why can't you just give her an antibiotic? Why do we have to have Tylenol?
Well, Epstein-Barr is a virus, and we don't treat viruses with antibiotics because they don't work. We have to let this virus run its course, so we treat by the symptoms.
Run its course? She has
Yes.
ball games she needs to be at.
Well, she won't be able to play any ball for about a month. Your spleen is swollen,
No
which is a
sports?
side effect of this virus. No sports.
For a month?
For a whole
I
month.
have to play basketball.
Actually, we can't put a time limit on how long you can't play the sport. We have to wait until the spleen has gone down, the swelling has left.
Ugh.
And for that matter, your whole team needs to be checked for this Epstein-Barr virus. So, Mama, you need to be sure to tell the gym teacher. I've written a prescription here for you for a Tylenol, like I said, with Tylenol, with codeine, for your sore throat, which I know has been very painful for you, and your muscle aches. Now, I want you to watch out for the signs of, you monitor her breathing for 24 to 48 hours. This side effect can have sedation and confusion, but the main thing is watch for agitation.
Agitation? She's 14. Like, I need more agitation.
Oh, Mother, don't be so dramatic. It could be so much worse.
Yes, you can have constipation, which is another side effect. Okay, Mom, I'm going to let Miss tell you the side effects for this, and that you need to watch out for her. You need to watch her for jaundice and a rash, which you need to.
What is jaundice?
It's where you turn yellow.
I could turn yellow.
Yes, this affects your liver and your spleen, and sometimes in the worst cases you do have jaundice, which you watch for the whites of your eyes turn yellow first before.
I look like a freak.
Wear a coordinating outfit. No one will notice. I'm just teasing, hon. I know this is hard for you, but if you'll pay attention to what your body tells you while you're sick, if it tells you that you are tired, you need to rest. If you start getting sick again when you've been feeling pretty well and think you're on your way to recovery and all of a sudden you have a relapse, we need to know as soon as possible. Or if you have the jaundice, if you're not able to drink fluids and eat like she needs to. A lot of this you'll know within yourself, and you be sure to tell your mother when it happens, okay? Mom, I've got this pamphlet for you to use, and it explains what causes the disease, and it shows you the things that you need to call us about. And do some saltwater gargles if you can, if you feel like it. You know, if your throat, even with the Tylenol and codeine, still hurts, use this warm, soft water gargles. And bed rest while running the fever. You don't need to be out with your fever. Now, you're not going to make anyone catch it, but it will help you to heal better if you will listen to your body and rest when you need to rest and drink plenty of fluids. Now, Nurse D will probably come back in just a few minutes and help you get your things ready to go. And do you have any questions? I'm so sorry to have to tell you, but you do need to tell the gym teacher about the mononucleosis and for the team to be checked. Y'all have a good day.